The Roman Empire was the most political and social structure in Western Europe that started around 800 BC. It was one of the largest and most powerful empires in history. Roman civilization developed in a different way compared to Greece, but Greek medicine had a huge influence on Roman medicine, and Romans adopted a lot of Greek medical ideas. By collecting knowledge from the conquered nation and people, Romans came up with one of the best and most sophisticated medical systems. When it came to health, the Romans preferred prevention than cure, and they had a religious and basic understanding of medicine. Many people strongly believed that disease was brought by gods, and that religious and spiritual practices can help them get rid of diseases.
In ancient Rome, anatomists began to learn human body, but because dissection of human body was forbidden, the anatomists usually dissected animals. They studied bone structure, muscles, blood, and nervous systems from animal dissection. Roman anatomist Galen clarified how the nervous systems sent message to the muscles based on his experiment on a pig. However, as he dissected animals instead of human body, he analyzed a few wrong theories. For example, he thought that liver produced blood and the blood burned off like fuel in the muscles. The Romans learned about how the body works, but they didn't continue to investigate diseases, and they rejected Greek ideas. So the causes of disease were confused. Some people believed that the cause of disease was poisonous vapor from the swamp or the stars, which was based on astrology.
The Roman Empire had high population, an influx of foreigners which made it an idealized place for disease to spread. Therefore, life expectancy were a lot lower than present. The native people that survive from childhood tend to have better immunity and has less chances of getting diseases, but the foreigners didn't. Even though the Romans noticed this problem and tried to solve it, their lack of knowledge usually will make the problem worse. Therefore, a variety of disease spread through the city. When the Timber River flooded, it created a great environment for infected mosquitoes to breed and spread malaria, as the stagnant water contains lots of bacteria. Malaria was the most common disease at that time. It caused a lot of deaths as it can infect the red blood cells, causing the cells to burst open. Other diseases like tuberculosis and leprosy were also present.
Roman diagnosis and treatment were the combination of local and Greek medical practices. The medicines, however, progress in diagnosis and treatment was slow and patchy during that time. There were still some people who believed that the god could heal the disease if they performed the correct spiritual acts. According to the Greek practice, some Roman doctors did clinical observation of people to observe some symptoms. The patients might also do a physical exam to find out what disease they had got. Sometimes quarrelsome consultations would happen as different doctors followed different theories. Most doctors thought that the healing power of nature was very useful, so there were many herbal medicines and remedies. For example, unwashed wool could use for sores. Fennel was used to cure nervous disorders. Some people would also take treatment like sage, as they still believed the god's infinite power.
Through the work of Galen, the Romans had some knowledge about how the human body worked, so the Roman surgeons could do lots of simple external operations. Most of the surgeons got their practical experiences on the battlefield. They knew to boil their tools before and after use, but it is doubtful that the Roman surgeons can perform internal surgical operations. The Roman Empire kept some of the surgical instruments from Greece and also developed some new surgical instruments. Scalpels is one of the instruments they used at that time. They could be made of steel, bronze, or the combination of the two metals. They also have a variety of different sizes. There are also other instruments like bone drills, hooks, bone forceps, and so on.
Public health was to keep the society in a healthy living condition and prevent spread of disease. Romans believed that prevention of disease was better than cure, so they usually chose a clean and healthy places to build camps, settlements, and etc. that could prevent mosquitoes and other creatures spreading diseases. To maintain public health, they also provided many social programs like hospital, public bath, and sewage systems. They built the first real hospital to treat soldiers in Rome. Aqueducts brought 222 million gallons of water into the city per day to ensure enough water supply.
Doctors in Rome were not highly regarded. The profession was considered as a low social position. After conquest of Greece, the doctors in Rome were usually slaves from Greece. Pliny is a Roman writer and naturalist who tried out his theories and methods at the time that cost a lot of patients' lives. Galen is the most famous doctor in Rome. Galen came from Pergamum. He became the most famous doctor in Roman Empire. Hospitals were developed in Rome. Military nurses are called medici, were skilled surgeons. They built their knowledge on Greeks' knowledge of anatomy and physiology. Because most of the doctors were slaves, that means anyone can call himself a doctor. Doctor during that period of time did try some ways that are effective and do valuable performs to the community. But more of them were just cheating on the patients. If their method doesn't work effectively, they will just move to another career. The recovery of patients were low. That makes people skeptical or even scornful of doctors.